All right, welcome to This Explainer. If you're a focused learner looking for real, concrete answers about a condition that honestly completely baffles most people, you are in the exact right place. Today, we're exploring how to deal with chronic pain and fibromyalgia by Professor Dr. Ahmad Satine. Professor Satine is a highly respected authority in pediatrics and medical genetics, and diving into his research literally changed how I view this often invisible illness. We're going to explore his findings together, so we can finally understand the actual science of this systemic inflammation and, most importantly, the clear path to healing. Let's get right into it.
Is it just in your head? It's a question millions of people living with chronic pain and fibromyalgia hear all the time from doctors, friends, or even family members. They get the standard tests done, the results come back totally normal, and they're told they're absolutely fine. But diving into Dr. Satine's work reveals something really profound. This suffering isn't some psychological fabrication. It's deeply rooted in physical, measurable science that we are going to unravel together today.
So here is our roadmap for today. Number 1, the reality of fibromyalgia. 2, the hidden causes of inflammation. 3, food sensitivities and deficiencies. 4, stopping the fire. And finally, Dr. Satine's root cause protocol.
Okay, let's jump straight into Section 1, the reality of fibromyalgia, beyond the invisible pain.
We've got to start by acknowledging the heavy physical and mental burden that patients carry every single day. Because this isn't just about feeling a little bit sore. It's wild to think about what severe joint pain has to do with something like eczema, or what irritable bowel syndrome has to do with crushing anxiety. But Dr. Satine's research shows these seemingly disconnected symptoms are actually pieces of the exact same puzzle. From severe obesity to numbness in your toes, fibromyalgia isn't a localized issue. It is full-body, brain-to-gut systemic chaos.
Moving on to Section 2, hidden causes of inflammation, the silent culprit.
So what exactly is that silent culprit? Well, it's low-grade inflammation. The massive amount of research on body and brain inflammation points directly to this stealthy condition. Unlike an infected cut that swells up visibly or an acute allergic reaction, this inflammation hums aggressively in the background of your biology. It's totally insidious. It's the true driver behind all those vastly different fibromyalgia symptoms we just talked about. And the kicker? Standard blood tests usually completely miss it unless you specifically look for it with markers with something like a high-sensitivity CRP test. Think about acute inflammation for a second. It's obvious, right? Your body is screaming for help with fast-acting, visible redness or sudden breathing difficulties. But low-grade inflammation, that is a master of disguise. It quietly degrades your joints, creating constant stiffness. It weakens the muscles, and terrifyingly, it actually attacks the brain. Dr. Satine's findings explicitly note that this chronic brain inflammation is the true cause of profound depression, anxiety, insomnia, and in some severe cases, even symptoms mimicking schizophrenia and delusions. It literally alters a person's neurological state.
Dr. Satine uses a really brilliant real-world example to make this concrete: rheumatic fever. When someone gets a strep throat infection, that's the acute phase. But a month or more later, the hidden, delayed, inflammatory response kicks in. The chronic inflammation starts attacking completely different parts of the body, causing joint arthritis, heart inflammation, and even brain and skin issues. It's the exact same stealthy mechanism at play in fibromyalgia. It's a delayed, chronic systemic immune response wreaking absolute havoc. Let's move to Section 3, food sensitivities and deficiencies. What's triggering the body?
If low-grade inflammation is the mechanism, what on earth is pulling the trigger? Dr. Satine separates our everyday triggers into 2 distinct camps. First, you have the foods actively provoking our immune systems, like the gluten found in wheat, barley, and oats, lectins in legumes, dairy casein, and modern vegetable oils that are packed with highly inflammatory omega-6. Then, on the other side, you have vital deficiencies. The body is literally starved of the exact tools it needs to fight back: vitamin D, A, C, depleted iron reserves, and crucially, the omega-3 DHA that the brain desperately needs to cool down that neurological inflammation.
It's a cumulative effect, really. It's the perfect storm. When you combine those heavy dietary triggers and severe nutritional deficiencies with extreme psychological stress and fatigue, your immune system essentially surrenders. It falters. And when it falters, hidden, chronic viruses and microbes take hold. They settle right in and perpetuate that low-grade inflammation cycle endlessly.
Section 4. Stop feeding the fire. Rethinking the treatment.
When we actually rethink treatment, we have to face a pretty harsh reality outlined perfectly by Dr. Satine. Medicine helps, but won't do anything if you have a fire and you keep feeding it with gasoline. If your body is on fire with low-grade inflammation triggered by gluten, casein, stress, and deficiencies, throwing a chemical painkiller at the symptoms while still eating those exact same inflammatory foods is, scientifically speaking, totally futile. You're expecting a burning house to put itself out while you're literally pouring gasoline all over the floor.
Relying purely on symptom management drugs might take the edge off the pain for a few hours, sure, but your fundamental biological reality remains completely unchanged. Medications definitely have their place in bridging the gap, but the only sustainable path forward is fighting the cause, identifying the root issue, decisively stopping the inflammatory gasoline, and actively rebuilding your depleted immune system from the ground up.
Which brings us to Section 5, the root cause protocol, healing from within.
So how do we tackle this? Dr. Seddon outlines a highly practical, full lifestyle overhaul. Step 1. Strictly implement a keto or paleo diet to naturally strip out the gluten, the toxic vegetable oils, and the processed sugars destroying your gut. Step 2. Aggressively replace those missing nutrients with targeted supplements to strengthen your immunity. Step 3 is fascinating. He points out the immense healing power of reducing psychological stress through a deep spiritual connection with the merciful Lord to truly deeply calm the nervous system. And finally, step 4, strict healthy sleep habits paired with appropriate, careful exercise.
But here's where so many well-meaning people stumble. The trap of, I tried that. People will often say, well, I tried a diet, and it didn't cure my fibromyalgia. Dr. Satine addresses this directly. He states that these approaches usually fail because patients implement them casually. They try it without an unwavering, strict commitment to both the absolute quality of the food and the quantity of the protocol elements. A half-hearted attempt simply is not going to extinguish a chronic, systemic fire that has been burning for years.
And there's a catch. 6 months. That is the absolute minimum amount of time you must strictly, flawlessly commit to this holistic protocol before you can accurately evaluate the results. Healing profound cellular and neurological inflammation takes real serious patience. You cannot try this for 3 weeks, feel frustrated, and just give up. 6 months minimum. You now understand the hidden inflammation, the everyday dietary triggers, and the scientific protocol needed to rebuild your body from the inside out. So the ultimate question is this. Are you going to keep throwing gasoline on the fire, or are you ready to finally starve the flame and heal the root cause? Thank you for joining me on this explainer, and here's to taking back true lasting control of your health.